Welcome to Oncology Data Advisor, and today's episode we're having in honor of Pride Month. I'm joined by two of our editorial board members, Dr. Lauren Ghazal and Dr. Jasmin Hundal, and they're here today to delve into the topics of LGBTQ plus cancer care, including disparities as well as resources to raise some awareness of this month. Thank you both so much for coming on. Always great to have you on the show.
Thank you, Kara.
Yeah, thanks for having us.
All right, Lauren, looks like we have a task today to discuss about cancer survivorship within our LGBT community. Would you like to kick us off with the interesting fact?
Oh, an interesting fact. So when we think about like LGBTQ populations, we know in the literature too that they refer to LGBTQ populations as sexual and gender minorities or sexual and gender diverse,
Mm-hmm.
SGM, SGD. But I think when you're working with the community, and as somebody who is LGBTQ, like we don't refer to ourselves as SGM or sexual and gender minority. So I think there is a big disconnect with like how research captures us and how we're called and that terminology,
Mm-hmm.
and how LGBTQ populations identify in identifying ourselves, I guess I would say. But I think we like I guess as like a primer overview of LGBTQ cancer survivorship. Um, we know that it's a vulnerable population with health and healthcare disparities. We know that there's higher cancer risks among LGBTQ groups who are diagnosed with cancer. We know that also health disparities appear in lower screening rates for specific cancers among LGBTQ individuals. A lot of it is related to perceived mistrust or perceived discrimination by LGBTQ patients as they
Mm-hmm.
access healthcare systems. And then, that mistrust and discrimination can also result in a lot of barriers to receiving affirming cancer care. And so there can be delayed diagnosis among these populations and poorer health and health outcomes. So we know a big thing, and probably something that we'll talk about later, is the importance of what we call SOGI data, or sexual orientation and gender identity data,
Mm-hmm.
and how, why it's so important because one, we can actually identify patients that we're working with, patients that we're doing research with, are actually LGBTQ, that we can start to identify disparities and help mitigate disparities, and then also focus, tailored, culturally relevant interventions that are catered to LGBTQ populations and identify their unique needs. So I guess you asked a very simple question of a fact, but I think I gave you more than that. So I'll turn it back over to
Yeah,
you.
Yeah, no, I think you hit it all. I agree with all of the above. And I feel like it's also a lot of like underreporting perhaps as well that we are seeing in the literature. But yes, definitely, like even if it's under like which is actually more worrisome if you think about it, right? Like we already know that there's lower screening and delayed care with the current reporting, and that we know is probably still underreporting. So imagine actually what if we do have accurate data, actually it's most likely even worse than what we think in the current situation. But I'm very hopeful for the future now that we have like more awareness and hopefully also with more education within our healthcare clinicians as well as like the support staff in the healthcare system now. As well as I believe like schools are now also very supportive in like, identifying and helping patients or, our community to identify themselves and being comfortable disclosing that to their physicians. And that will lead to accurate documentation as well as counseling down the road. And I think also social media, I think, plays a very important role right now with this awareness. And as well as I feel like which is good in a way because of the increased awareness and education that we're able to provide with the social media. But also at the same time, I feel like I fear that there's also a lot of misinformation which prohibits you going and seeking care. But I'm hoping that, with the increased awareness again, that we do have are on top of it, which will lead to improved care, increased screening rates, as well as if we are able to support our community with the appropriate treatment and procedures if needed within our community, and then if they get the education on how and who they should follow up, I think that will hopefully alleviate the burden that unfortunately our patients have to suffer through.
Yeah. Yeah. I think a lot of what's wrapped up in that and what drives a lot of like the theoretical underpinnings and framework of these studies,
Mm-hmm.
the concept of minority stress,
Mm-hmm.
and its impact on health outcomes, access to healthcare, engagement in the healthcare system. That it's not
Mm-hmm.
just one, um, one event thing. It's really that layering of traumatic events that can cause these detrimental outcomes that we see that are linked to minority stress for LGBTQ patients and their caregivers and
Yeah.
families, I would say. I think a important part of that too is the resilience. I think we do a lot as researchers in focusing on almost like the deficits based approach of, okay, what is the trauma that's associated with this, but then also what's the resilience and the growth that's seen in
Mm-hmm.
the LGBTQ cancer community that we can uplift, we can amplify now, we can continue to share those stories and those interactions with the healthcare system. And then I think from a systems or organization perspective too, what are examples of continued LGBTQ strength and resilience in the workforce, the healthcare workforce, but then also in healthcare settings. So like I think about like I will probably never leave my lanyard badge or my rainbow lanyard badge that I have just to, you know, um, uh, show visibly and publicly my support for the LGBTQ community. Yeah.
Yeah, I totally agree with that. I think just being outspoken sometimes helps a lot. What are your thoughts on like the current guidelines that we have for survivorship or even providing care once you get diagnosed with cancer or are going through the journey of cancer? What are your thoughts on the current landscape of the survivorship care and support that we're providing?
Yeah, no, that's a great question. I think there was a lot of movement by incredible people at the forefront of like LGBTQ cancer research
Mm-hmm.
that were looking at not only SOGI data collection and being able to identify the LGBTQ cancer population, but then also thinking about, okay, how do we, whether it's adapt some of those recommendations for survivors and their families, um, or maybe it is supplement a little bit of that with, um, identifying what unique needs LGBTQ individuals have
Mm-hmm.
as they are accessing cancer care. So I think those guidelines, again, they're a guideline for all cancer survivors, but we know that there are populations within all cancer survivors that have additional challenges or maybe additional considerations when we think about fertility preservation and family building, right? I think the most recent guidelines just included LGBTQ family building and just acknowledgement of LGBTQ cancer survivors in their I believe it was the ASCO fertility preservation guidelines. And so indication that there are I hate to say this again, but just additional considerations
Mm-hmm.
and understanding that these populations, our populations, will perhaps need other resources, may need some tailoring with interventions. That was, a whole line, I think, of funding that unfortunately was terminated. And so it's I think it's a challenging time in the research space to be doing LGBTQ research for sure. And it's a challenging time, I think, to be also an LGBTQ patient with cancer and not knowing, I guess, if SOGI data is being collected, how can I ensure that it's being protected too? And how can I ensure that it's not going to be weaponized against me in the future? I think that's something that we're hearing from communities that I work with of cancer survivors who are LGBTQ. It's a struggle where we fought so hard for SOGI data collection.
Yeah.
But yeah, I think a piece of that too, and I'd love to hear your thoughts too on like how do we continue all of this work in community engaged research, especially for LGBTQ cancer survivors amid
Yeah.
with challenges.
Yeah, definitely. I think there is, as you said, there are a lot of challenges, and I feel like it's just,
Um,
I feel like it goes back to like education, like, right, educating and bringing up awareness of those guidelines, because I feel like the guidelines are there, but if you are not paying attention to those guidelines or promoting the guidelines, I think um, that goes back to it. And I think like that's where like within like healthcare systems, like mini QI projects play a very important role to bring awareness within the healthcare system, where you are able to evaluate like what are your current practices and how well are we performing. And I think like having internal QI projects and of course like then putting them also presenting them at conferences
yeah,
brings increased awareness about it because I've been to, especially like the ASCO QI conference that's coming up, right? Even if you just walk through those poster sessions, and sometimes you go by a poster and you're like, wait a minute, like this has been on my mind, and like it just provokes a thought-provoking process in your mind, and then you take that back to your institution and present it. Um, so I think like small QI projects sometimes can lead to a really big impact, even with a small idea. Um, and I feel like QI projects can really be done by any level of clinicians, doesn't have to be physician-led, because I think some of them that I've seen, especially with care providing abstracts, are usually from nurses and like because they see it firsthand, or like social workers or like basically support staff. Um, which then like with collaboration with clinicians and whatnot can be very, very powerful.
mm, yeah, yeah. I know as a nurse practitioner, I appreciate that uh, a lot of I think earlier studies, um, you know, were led by a lot of nurses, social workers, definitely supported by MDs and other healthcare providers as well.
Hmm.
Really identifying like how true interdisciplinary teams can work together to improve LGBTQ cancer health, quality of life, um, all of these things.
And
Uh,
especially like right now, I feel like cancer care is multidisciplinary from the time you enter the door. It should be, right? Like, you see everyone from the front desk, I feel like, to like the financial. I feel like this like that's like why like also like is my calling to oncology, because I feel like it's a total like teamwork, you know what I mean? Like it's literally we have everybody on board and everybody has to work in coordination in order to sail the ship smoothly.
yeah, yeah. I I wanted to a little bit just like reflect more on the importance of Pride and the
Mm-hmm.
importance of this month, right? And June is Pride across the US, right? There was just World Pride in DC last weekend. At the end of the month in Seattle, that's also going to be the weekend that Mask will be in Seattle.
Oh yeah.
So I
Are you
think
gonna be there?
yes, very exciting time. I won't be presenting on LGBTQ research there, but there will definitely be, a celebration of Pride, I think, at the end of Mask. But I wanted to just take some time to think about how Pride specifically and the recognition of LGBTQ resistance, resilience, like honoring of the history of Pride, how that you know how that can be brought into cancer care delivery. And I think it's easy for us to think about, okay, the LGBTQ cancer population, but are there other ways that we can incorporate, the significance of Pride in our day-to-day work as well?
That is a very good question. I think day to day is really just like awareness and discussing, especially during Pride Month, because I feel like these awareness months go by, it's just 1 month at a time, but sometimes it can really be powerful and impactful. So perhaps like again, like you could have like especially during this month, right? You can propose like a weekly um like in like whether it be a lecture or like a an informal like meeting within the staff, like or like promoting just information via email or newsletters. I think during this month, because I feel like everybody is paying attention, because everybody, as you mentioned, like everybody is celebrating. So I feel like we should take the advantage of the momentum and utilize that. What are your thoughts on that?
Yeah. No, I agree. I agree because I think Pride is not just for LGBTQ populations too.
Yeah.
And we know that it amplifies other underrepresented groups as well. So um, I think that it's a meaningful time, and it's a really important time to also bring together, your employees as well and your colleagues, to advance the goals of what we do in oncology and what we do in research is to improve health outcomes, um,
Mm-hmm.
and work with communities to be able to do that. Yeah. Uh,
Yeah, I think it just reduces like the fear, the stigma that comes up. It like just opens up the communication and most importantly, just builds trust, right? Like I feel like that's the most important thing, like to be able to build trust and then to open the doors for people of anyone, of any color, of any kind of like background to be able to come and seek care.
yeah. Have you, and I'm gonna kind of pivot this a little bit to like
Yeah.
cancer support organizations that support LGBTQ communities. I know, there's the National LGBT Cancer Network that has launched the first Out with Cancer survey. They held that. They do a lot of like cultural competence training, LGBTQ education training for healthcare providers. A lot of research partnerships and publish a lot of their data. Um, and really around like education, advocacy, and training for LGBTQ providers to improve cancer care for LGBTQ populations. There's also Escape, which is an adolescent and young adult cancer organization that's focused on supporting AYA, LGBTQ cancer survivors. And then I know, like within other organizations like Cancer Care, like Stupid Cancer, there are like LGBTQ support groups and individual groups as well. But are you familiar with any other like online communities, resource groups, thinking about in just supporting LGBTQ people with cancer?
Honestly, I don't, to be honest. Yeah, I've only the ones that you mentioned, but other than that, I'm not aware of any other ones.
Yeah. We think about, and I don't think there's many, and like I think that's the
Mm-hmm.
point as well too, for broader LGBTQ health or research organizations. We know things like Fenway Health or the Fenway Institute, and then there's GLAMA, which I love their acronym. I think it's just like a beautiful name. But they
Yeah.
are like they provide advocacy and education for LGBTQ healthcare leaders, so not just oncology but across
Mm-hmm.
other healthcare sectors. Um, and I think like other like orgs, initiatives that I think are important to think about are within like the human rights campaign. So I'm up at the University of Rochester in Rochester, New York, and we have a Western New York contingent. Just got to attend the HRC gala here a few weeks ago, and there was a huge, uh, you know, representation from our university as well in our cancer center, which was just so welcoming to see. And we know that that's the HRC and the Human Rights Campaign is important as it relates to like the Healthcare Equality Index, so HEI. When we think about, whether institutes, organizations, hospitals, cancer centers are inclusive and rate high on that LGBTQ equality index. So
Mm-hmm.
those are just a few that
Yeah.
I'm thinking of.
Yeah, definitely. And I think like I also recently American Cancer Society, I think they had like a separate like page for like engagement groups. And I feel like also
Yeah.
the Leukemia Lymphoma Society, I think like within, as you said, like within bigger like organization like the Leukemia and Lymphoma or American Cancer Society are actually like, having including LGBTQ resources on their websites, which is very helpful, right, for patients or
Oh,
for people
totally.
to go to or for caregivers, even if it's not the organization within themselves, but they do provide you with links, to go into those sub-organizations, which I find is very, very helpful and very inclusive and much needed. So I was very happy to see that those bigger national organizations have a special page where patients can go to look for resources.
Yeah. I think the final thing that I wanted to share is I recently had the real privilege of giving grand rounds at a cancer center, and I finished my presentation with kind of like top 7 things we could do as healthcare providers, as researchers to help improve LGBTQ quality of life. And so I talked about, continuing to promote LGBTQ affirming cancer care environments. So like showing your visibility and pride in terms of having like a rainbow lanyard, right? A little thing like that, or even like a
Yeah.
rainbow flag if you can in your office, in your hospital space. That I think having like a pronouns badge that helps so much, even as a nurse. I think it allows patients who may be questioning, maybe closeted or maybe out, and just to be able to see that can provide a more affirming space. And it's a very little thing. Um, we talked about like integrating mental health and psychosocial support also in that care, knowing that LGBTQ cancer survivors have higher or greater distress and worse mental health outcomes than non-LGBTQ populations. I think what's important and is still like very minimally researched is the intersection of financial hardship and LGBTQ identity. And so we know that financial navigation and legal support is so critical to this population when thinking about something like family building, right? And how there may be more legal complexities to that for an LGBTQ couple than for a cisgender or heterosexual couple. Um, Another thing was the importance of peer and community-based interventions and that community-based participatory research. Um, we talked about, again, fertility, sexual health counseling, which is another kind of unmet need among LGBTQ cancer survivors. The importance of accurate data and representative data, which we know is linked to SOGI data. And then I ended with just this call for comprehensive survivorship education and navigation for LGBTQ people and their families. So I don't know if there was anything else in there you wanted to reflect on, but those were kind of
No.
my takeaways.
Yeah, no, I think congratulations on, being able to give such a great presentation, much needed. And I think it was very timely. So no, thanks for doing that and sharing what you discussed.
Well, if there's nothing else, I think I just wanted to end by wishing everyone a happy Pride Month. I think it's so important that we continue to honor and celebrate this month and do what you can to honor the history and the advocacy of LGBTQ people, LGBTQ cancer survivors and their families, so that we can all work toward this goal of improving healthcare and cancer outcomes for all.
Yeah, I agree. We have to like be together in order to make the change.
Awesome. Well, I love all these insights that both of you shared today. I'm really glad you're able to have this conversation to both bring awareness to these disparities and gaps in care, as well as share these resources that you mentioned to help improve care, and also just to celebrate Pride this month. So thank you both so much again, and I'll end by saying happy Pride as well.